3 minutes, the edge of any sturdy table or kitchen counter. That is all the first technique requires. And what it does for your sciatic nerve is different from almost every other stretch you have tried, because instead of just loosening a muscle, it gently decompresses the spine itself, creating space at the exact level where your nerve root may be getting pinched. Then I am showing you a second technique that works in a completely different way, one that restores the natural gliding movement of the nerve itself rather than the space around it. Two techniques, two common mistakes that cancel out the benefit of each, walked through together so you get both right the first time. Stay with me. My name is Dr. Michael Kent, 20 years working with seniors managing sciatica. Drop a comment below right now, your age and your city. I read every single one personally. Now let us get completely into this. Why most stretches stop short of what your nerve actually needs. Most stretches you have tried for sciatica work on muscles. The piriformis stretch loosens a tight muscle in your hip that may be pressing against the nerve. The hamstring stretch loosens a tight muscle in your thigh that the nerve runs alongside. These are genuinely helpful, and if you have followed this channel, you have likely tried several of them already. But here is what almost nobody explains clearly. These stretches work on the soft tissue surrounding your spine and the muscles surrounding the nerve. They do not work on the spine itself, and they do not restore the nerve's own ability to move freely through the tissue around it. Tonight's two techniques address both of those missing pieces. Technique 1, the counter edge decompression stretch. This technique is called spinal traction, or decompression. Instead of stretching a muscle, it gently creates additional space between the vertebrae in your lower back. When a disc has bulged slightly, or a nerve root is being compressed at the point where it exits your spine, even a small increase in that space can meaningfully reduce pressure on the nerve. This is the same basic principle behind decompression tables used in some physical therapy clinics, simplified into something you can do at home. Here is exactly how to do it. Find a sturdy, stable surface at roughly hip height, a solid kitchen counter, a sturdy table, or a massage table edge if you have access to one. Test the surface for stability before you begin. Lie face down across it so your hips are right at the edge. Upper body supported on the table, legs hanging down toward the floor with knees slightly bent, feet not quite touching the ground if possible. Rest your forehead on your folded arms in front of you, keeping your neck relaxed and neutral. Let your entire lower body hang freely. Do not tense your legs or try to hold them up. Hold this position for 2 to 3 minutes, breathing slowly throughout. You should feel a mild sense of release or space in your lower back, never sharp pain. The mistake that cancels this technique completely. The mistake is tensing your legs or actively holding them up instead of letting them hang completely relaxed. When your leg muscles are engaged even slightly, you create tension that pulls back against the very traction effect you are trying to create. The decompression only works when your lower body weight is allowed to hang freely under gravity, with your hip flexors and lower back muscles completely relaxed. If you notice your legs tensing automatically, consciously check in every 30 seconds and deliberately release that tension. A second smaller version of this mistake is using a surface that is too high or too low, which prevents proper relaxed alignment. The edge should sit roughly at your hip crease, not higher near your ribs or lower near your thighs. Technique 2, sciatic nerve glides. Here is something most people never realize about their sciatic nerve. It is not a static cable sitting still inside your leg. It is designed to glide and slide slightly within the tissue surrounding it every time you move, the same way a guitar string moves slightly within its housing. When sciatica has been present for a while, the tissue around the nerve can become stiff and the nerve itself can lose some of this normal gliding ability, becoming slightly stuck or adhered to the surrounding tissue. This loss of mobility is a completely different problem from a compressed disc, and it requires a completely different solution. Nerve glides, sometimes called nerve flossing, are a gentle movement designed specifically to restore this natural sliding motion without aggressively stretching the nerve itself. Here's exactly how to do it. Lie flat on your back on a comfortable, firm surface. Bend one knee and bring it toward your chest, holding the back of your thigh with both hands. Slowly straighten that knee, extending your foot up toward the ceiling, going only as far as feels like a mild stretch, never a sharp pull. As you straighten the leg, gently flex your foot, pulling your toes back toward you. Hold this fully extended flexed position for 2 to 3 seconds. Then, as you slowly bend the knee back down toward your chest, point your foot away from you, toes reaching forward. This coordinated movement, knee straightening with the foot flexing, then knee bending with the foot pointing, is what creates the gentle gliding motion through the nerve. Repeat this slow, controlled movement 10 times on the same leg, then switch and repeat 10 times on the other leg, even if only one side is affected by sciatica. The mistake that cancels this technique completely. The mistake here is moving too quickly or stretching too aggressively, treating this like a normal hamstring stretch where you hold a deep stretch for 30 seconds or more. Nerve glides are not meant to create a deep, sustained pull. The nerve tissue responds to gentle, repeated motion, not prolonged tension. Holding the extended position for too long or pulling hard enough to feel a strong stretching sensation can actually irritate an already sensitive nerve rather than helping it glide freely. The movement should feel like a mild, comfortable motion you could comfortably repeat many times, never an intense stretch you are straining to hold. If you feel any sharp pain, tingling, or increased numbness during this movement, reduce how far you extend the leg until the movement feels completely comfortable, even if that range feels small at first. A second version of this mistake is rushing through the repetitions. Each rep should take about 4 to 5 seconds total, 2 to 3 seconds extending and flexing, then a smooth return. Doing this quickly turns it into a different exercise entirely and loses the specific gliding benefit the slow, controlled tempo creates. Putting both together. These two techniques work well done back to back, ideally once or twice daily. Start with the counter edge decompression for 2 to 3 minutes to create space and ease pressure at the spine itself. Follow immediately with 10 nerve glides on each leg while that sense of space and ease is still present, allowing the nerve to move more freely through tissue that has just had some of the pressure on it relieved. Many people find mornings ideal for this combination, before the discs have been compressed by a full day of sitting or standing, though evenings work well too if mornings are difficult. This is not a one-time fix. The benefit comes from consistency. Most people notice the clearest effect immediately after doing both techniques. A temporary easing that can last several hours depending on how compressed and irritated things currently are. Over consistent daily use across several weeks, many people notice the baseline tightness and pressure throughout the day gradually decreasing. These techniques work well as a complement to the other approaches discussed on this channel, not as a replacement for addressing the muscular and inflammatory factors also contributing to your sciatica. This is general educational information. If you have osteoporosis, a recent spinal fracture, or any condition affecting bone density or spinal stability, check with your doctor before trying the decompression technique. If you experience sharp pain, increased numbness, or new weakness at any point during either technique, stop immediately and seek medical attention. Drop a comment and let me know which of these two you found more helpful. Subscribe for more techniques like this every week. This video is for educational and informational purposes only. It is not intended to diagnose, treat, cure, or prevent any disease or medical condition. Those with osteoporosis, recent spinal fractures, or spinal instability should consult their healthcare provider before attempting the decompression technique. Stop immediately if you experience sharp pain, increased numbness, or new weakness, and seek medical attention. Individual results vary. Dr. Michael Kent is a senior health educator with 20 years of experience, not a licensed physician. Viewer discretion advised.